Startling but true, 1 in every 4 adults in Uganda suffers from hypertension, a silent killer. This condition, also known as high blood pressure, is a prevalent health concern that often goes unnoticed until it's too late. It's a stealthy assailant, creeping in without symptoms, damaging blood vessels and the heart, often leading to devastating consequences like heart attacks, strokes, and kidney disease. Recent research studies paint a concerning picture of hypertension in Uganda. The prevalence of this condition is on an alarming rise, with a quarter of the adult population affected. This means that for every group of 4 adults you encounter, chances are one of them is grappling with this silent killer. But why is this a significant health concern? Hypertension is like a time bomb. It quietly does its damage, often showing no signs until it's progressed to a dangerous point. It's a leading cause of cardiovascular disease, the world's #1 killer. When you think about it, the implications are staggering. A quarter of Uganda's adult population is living on borrowed time, their bodies slowly succumbing to the damaging effects of high blood pressure. What's even more worrying is that many of these individuals are not even aware of their condition. Lack of awareness and inadequate diagnostic facilities mean that many Ugandans are walking around with ticking time bombs in their bodies, oblivious to the danger lurking within. The data from these research studies is not just numbers on a page. They represent real people, with real lives, families, dreams, and aspirations. Each one is a story, a life potentially cut short by a condition that is, in many cases, preventable and manageable. This shocking statistic is a wake-up call, emphasizing the urgency to address hypertension in Uganda. We must confront this silent killer head-on, raising awareness, improving diagnosis, and providing accessible treatment. The fight against hypertension is a fight for the heart of Uganda, a fight for its people, and a fight we cannot afford to lose. Understanding the root causes can be the first step towards fighting this silent killer. So, let's dive deep into the major factors contributing to the high prevalence of hypertension in Uganda. Firstly, lifestyle habits play a significant role. As the world becomes more globalized, Uganda has seen a shift towards more sedentary lifestyles and the consumption of processed foods high in salt and fat. These lifestyle changes can lead to obesity, which is a major risk factor for hypertension. Moreover, tobacco and alcohol use, which are quite prevalent in Uganda, also contribute to the problem. Next, we can't overlook the role of genetics. Hypertension often runs in families, and research suggests that people of African descent may have a higher genetic predisposition towards developing the condition. However, it's not just about lifestyle and genetics. Inadequate healthcare infrastructure is another major factor. In many parts of Uganda, especially rural areas, access to health services is limited. This means that many people with hypertension may not even know they have it until it's too late. Regular health checkups and screenings can catch hypertension early, but without access to these services, the disease often goes undiagnosed and untreated. Lastly, there's a significant lack of awareness among the population. Many Ugandans are not aware of the risks and symptoms of hypertension, nor do they know how to manage it if diagnosed. This lack of knowledge is a significant barrier to reducing the prevalence of hypertension. It's important to note that these factors don't exist in isolation. They're intertwined, each one feeding into the other. A person's lifestyle habits may be influenced by their knowledge and understanding of the disease. Their access to healthcare may determine if they can get diagnosed and treated. And their genetic predisposition may be exacerbated by their lifestyle and lack of medical care. The intertwining of these factors makes hypertension a complex problem to tackle in Uganda. But understanding these causes is an essential first step towards finding effective solutions to combat this silent killer. While the statistics are daunting, the fight against hypertension is far from lost. The battle against hypertension is not one we can afford to lose, but it's also not one we have to fight alone. There are a multitude of strategies and interventions that can be employed to manage and prevent hypertension, each acting as a vital soldier in this combat. One of the most critical arsenals in our fight is a healthy diet. Consuming a well-balanced diet, rich in fruits, vegetables, lean proteins, and whole grains can help reduce blood pressure levels. Cutting back on sodium and alcohol intake and avoiding processed foods can also make a significant difference. Regular exercise is another powerful weapon. Staying physically active can lower your blood pressure, manage your weight, and reduce stress, all crucial factors in the fight against hypertension. The key is consistency. Even moderate activities like brisk walking or cycling can yield significant benefits if done regularly. Medication plays a pivotal role too. For some, lifestyle changes may not be enough, and that's where medical intervention steps in. Antihypertensive medications can help bring blood pressure down to safer levels. However, it's crucial to follow the prescribed course and consult healthcare professionals regularly to monitor progress and adjust treatment if necessary. Regular checkups are the reconnaissance missions in this battle. Regular blood pressure screenings can help detect hypertension early, making it easier to manage and treat. Remember, hypertension often has no noticeable symptoms, earning it the nickname the silent killer. Regular screenings can help catch this adversary off guard and nip it in the bud. The fight against hypertension is a team effort, with every strategy playing a vital role. It's about making conscious choices every day, taking medication as prescribed, and staying vigilant with regular screenings. A multifaceted approach combining lifestyle changes and medical intervention can help control this burgeoning health issue. With everyone on board, we can turn the tide in this battle against hypertension, one healthy choice at a time. Despite the potential solutions, the road to curbing hypertension in Uganda is fraught with challenges. One of the most significant hurdles is the lack of awareness. Hypertension, often known as the silent killer, goes unnoticed until it's too late. Many Ugandans are oblivious to the risk factors, symptoms, and the dire consequences of uncontrolled hypertension. This lack of knowledge inhibits early detection, prevention, and timely treatment. In addition, the healthcare system in Uganda grapples with inadequate facilities. The shortage of well-equipped medical centers, especially in rural regions, poses a substantial barrier to managing hypertension. Moreover, the scarcity of trained healthcare professionals exacerbates the situation. With limited access to quality healthcare, many Ugandans are left to battle hypertension without adequate support or treatment. Socioeconomic factors also play a pivotal role in this conundrum. Poverty, malnutrition, and the high cost of medication hinder the effective management of hypertension. In a country where nearly a quarter of the population lives below the poverty line, affording a balanced diet or regular medication can be a daunting task. Furthermore, there is a pressing need for more comprehensive and inclusive research on hypertension in the Ugandan context. The majority of studies and interventions are often based on data and models from high-income countries. This lack of localized research hampers the development of effective strategies tailored to Uganda's unique challenges and needs. These limitations are not insurmountable, however. They present an opportunity for innovation and collaboration. A multifaceted approach is required, one that combines public education, enhanced healthcare services, socioeconomic upliftment, and extensive research. These challenges highlight the need for concerted efforts from individuals, communities, healthcare providers, and policymakers. Together, we can turn the tide against hypertension in Uganda, transforming it from a silent killer to a well-understood and manageable condition. The battle against hypertension in Uganda is a collective responsibility. It's a battle that demands unified action, a battle that requires us all to stand together against a silent enemy. This enemy, hypertension, is not just a health condition. It's a life-altering reality for many Ugandans, a silent killer lurking in the shadows. We've journeyed together through the landscapes of this issue, exploring the alarming statistics, the causes, the treatments, and the limitations that Uganda faces in its fight against hypertension. We've seen how hypertension is a significant health concern, with 1 in 4 adults in Uganda living with this condition. We've delved into the causes, from genetic predispositions to unhealthy lifestyles, and we've looked at the available treatments, from medication to lifestyle changes. But the fight against hypertension is far from over. The limitations are real and pressing. The lack of awareness, the scarcity of resources, the challenges of accessibility, these are all substantial obstacles standing in the way of a hypertension-free Uganda. But despite these challenges, there's hope. And this hope lies in us, in our actions, in our choices. We can spread awareness about hypertension, its causes, its impact, and its treatment. We can encourage our communities to adopt healthier lifestyles, to go for regular checkups, to take their medication as prescribed. We can lobby for more resources, for better access to healthcare, for more research into hypertension. This is our call to action. It is a call that asks us to step up, to make a difference, to change the narrative of hypertension in Uganda. It's a call that seeks not just to inform, but to inspire. It's a call that demands not just understanding, but action. Let's answer this call. Let's stand together against hypertension. Let's make a difference. Because with awareness, action, and perseverance, we can turn the tide against hypertension in Uganda. The battle against hypertension is not just a battle for health, but a battle for life, a battle for a healthier, happier Uganda. With awareness, action, and perseverance, we can turn the tide against hypertension in Uganda.